All right, so this is the spirometer I was talking about, and then right here I'm gonna show the graph of the spirogram, so I can see the air going in and out. So, a couple instructions: you're gonna make a tight seal around the mouthpiece with your mouth in between your teeth, and if we need to, we can use nose clips if you breathe out your nose. And you're gonna breathe in fully, so take a deep breath in, and then you're gonna force all the air out of your chest as fast as hard as you can until the lungs are completely empty. And then when you feel like you can't breathe out anymore, then I'm gonna have you breathe in one more time, a deep breath in, and then you can relax. All right? So we're gonna do that 3 times. So, tight seal in between the teeth. So, long breathing. All right, now take a deep breath in. Blow out. Blow, 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 blow. Keep blowing. Blow, blow, blow. Deep breath in. Good job. All right. You need to relax for a minute.
So, it's different.
Mm-hmm.
So do they do these at bedside?
Yeah, you can. All right. So, we'll breathe in. Deep breath in. Blow out. Blow, 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 blow. Keep blowing. Deep breath in.
How's that?
Good. All right, one more time. You want to take a break? All right, deep breath in. Blow out. Blow, 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 blow. Keep blowing. Deep breath in. Good job. Whew. So we usually do that 3 times to make sure that we get an accurate reading, make sure they're in a good measurement.
Well, now I understand a bit more how spirometry is a valuable tool used in diagnosis of COPD. How often do y'all do these?
It is assessed on a as-needed basis. The goals of COPD assessment are to determine the severity of the disease, its impact on the patient's health status, and the risk of future events, exacerbations, hospital admissions, death, in order to guide therapy. Assess the following aspects of the disease separately: symptoms, degree of airflow limitation using the spirometry, risk of exacerbations. Comorbidities. Symptoms are assessed by a validated questionnaire such as COPD assessment test, CAT, or the clinical COPD questionnaire are recommended for a comprehensive assessment of symptoms. The Modified British Medical Research Council scale provided only an assessment breathlessness. So here I have a questionnaire right here for you to look over. And you can look over that in your free time. So some risk of exacerbations are assessed. An exacerbation is defined as an acute event characterized by a worsening of the patient's respiratory symptoms that is beyond normal day-to-day variations and leads to a change of medication. The best predictor of having frequent exacerbations is a history of previous treated events. The risk of exacerbations also increases as airflow limitations worsens. Hospitalized for a COPD exacerbations is associated with poor prognosis with increased risk of death. So cardiovascular disease, osteoporosis, depression, anxiety, skeletal muscle dysfunction, metabolic syndrome, lung cancer, among other diseases occur frequently in COPD patients. These comorbid conditions may influence mortality and hospitalizations and should be looked for routinely and treated appropriately.